Hi everyone, Andy the physio here. So now that you've been working on your posterior pelvic tilts, or if you haven't, then click on the related video. What we're going to do now is go on to a bear plank and progress that to a bear crawl. What these exercises will do is really ingrain that posterior pelvic tilt action and get you working in that kind of position to really strengthen it up so that you can work your way out of that anterior pelvic tilt that you might be stuck in. So we'll be doing this in 3 phases as a progression. So do whichever one you find is most suitable to your level. Otherwise, if it's too easy, move on to the next one. Let's get to it.
Starting off with the bear plank hold, we are having hands underneath shoulders, knees underneath hips, and we're simply lifting the knees off the floor. So as you can see, we're trying to keep a straight back with this, and the shins are also quite horizontal. We're pretty much feeling it in the core. You might be feeling it in the shoulders a bit, or even the knees a bit as well, but mostly this is a core exercise. So what not to do? We do not want you to be overarching your back like this, or alternatively sticking your butt out like that. So that's pretty much the anterior pelvic tilt. Good job! Moving on to the next progression, we're going into a bear plank hold, so the same exercise but simply with one leg. So what we're going to do is get into that same position, hands underneath shoulders, knees underneath hips, lift the knees off, and we're simply going to raise one leg off the ground. So keep in mind that this is going to put a lot more pressure on the other leg, and you're going to feel a lot more in terms of the core activation here. Keep things as stable as possible. Again, the straight back as you can see, and then bringing the leg back down, going to the other one. So you can hold this for about, start off with 10 seconds and work your way up, but otherwise feeling it in the core, come back down. So what not to do with this? As you lift up the one leg, try not to tilt all the way around to the other side, so pretty much not keeping a stable base. Making sure that when you do lift up the one leg that you keep everything as steady and frozen as possible, not letting everything drop to one side. Alright, good job! And for the final, we're going for the bear crawl. Moving into that position again, start off with the hands on your shoulders, knees on your hips. We are moving forward. So it's going to be opposite arm, opposite leg, moving forward and back. And with this, really trying to keep that back straight as possible. Try and keep your shins as horizontal as possible to the ground, as you can see. But pretty much keeping the core activated as well as you move up and down. What not to do? We don't want to keep the butt stuck up, so let's not do that. Otherwise, that's not the posterior pelvic tilt anymore that we've been working on. Again, not letting the hips sway side to side like we did the single leg. These are not easy, so good work on trying them out.
Alright, congrats on trying out those progressions. If you find any of them a bit too difficult or a bit too easy and you're not sure where to go from there, or alternatively, if you're just not getting it at all, then give us a call or contact us at Activ Therapy. Otherwise, keep progressing with those core exercises and let's get you stronger and more pain-free than ever. Take care and stay active.